Let's dive back into a little bit of diastasis recti talk. There are 3 different places on our abdomen that DR can present itself. There's upper, midline, and below the belly button. If you think you have upper DR, are feeling or seeing that rib flare or wider ribs since postpartum, or if you're seeing coning above the belly button, then let's go over these exercises that are beneficial for upper diastasis recti. First, you do want to make sure that you are able to correctly diaphragmatically breathe. When we perform diaphragmatic breaths, our ribs are playing a part. They expand, and then on the exhale, they come in and down. If we don't recruit our ribs on the exhale, they may stay flared. So as we exhale, they are expanding, and then watch here, as I exhale, I'm recruiting them, bringing them in and down, ensuring that they are where they need to be, making sure that that flare isn't getting worse. I always recommend practicing this before beginning any of the following exercises because it plays a super important role. You can also include some thoracic mobility in your movement to help with that upper diastasis recti and rib flare as well. These are a couple of my favorite examples right here of that open book stretch, cat-cow, and then these floor angels, and then these kneeling angels are really great to help control your ribs, making sure they're coming in on that exhale. And then finally, this kneeling thoracic mobility exercises. Now onto our exercises. This is a supine heel slide with a band pull apart, really targeting that upper DR. As we exhale, we are simultaneously sliding our leg and then pulling that band. Next up is a bridge with a ball squeeze. You'll see I just placed that ball in between my knees, and then a lat pull down. So much working at once. Exhale, bridge up, squeezing our knees together, recruiting our pelvic floor, and then that lat pull down is encouraging those ribs to come down. Next up is a side lying hip raise with a band pull apart. Anytime we add in that band pull apart, it is going to help recruit that upper abdomen. Next up is pal off variations. These are anti-rotational and anti-extension core stability exercises, which means you're resisting movement rather than creating it. They train the transverse abdominis and the oblique, which provide tension to the midline and help support the upper rectus abdominis. This upright position is also going to help reinforce that rib control, which is going to help us maintain and avoid that rib flare. So we are exhaling as we rotate and then bringing it back to center. And the final exercise is kneeling crisscross band pull aparts, again, utilizing that band pull apart. So there you have it. And do keep in mind that there is not just one exercise that is going to help fix a diastasis. And oftentimes, DR can be related to rib flare or pelvic issues or just any other underlying postpartum issues. Also, I will leave you with this. Some DR is okay. 1 to 1.5 fingers is considered normal and totally livable. Hope this is helpful. Stay tuned for more exercises to help target lower diastasis.